Hello everybody, this is Joe Freudenberg with OakBend Medical Center coming to you today to have a cup of Joe, talk about healthcare topics that are important to all of us as we go through our lives. So I'm joined today by Dr. Gildardo Ceballos. Internal medicine, has been practicing for 26 years, 13 years here at OakBend Medical Center.
Yes.
Thank you so much. A really great guy, great physician. We're blessed to have you as part of our medical staff and taking care of our patients. Today we're here to talk a little bit about our skilled nursing facility, which is a unique facility. It's the only one of its kind in the Houston area that's attached to a hospital. And I understand you admit your patients here to our skilled nursing facility. You're our medical director of over our skilled nursing facility, as well as over our senior care unit for our seniors with mental health issues. What makes you choose our skilled nursing facility for your patients?
Well, Joe, thank you so much for your invitation. I'm glad to be here, sharing this cup with you. Well, our skilled unit is unique, and I have the opportunity to be in another skilled units.
Yeah.
But our skill, and I said our because I've been the director for more than 10 years, is unique because it's attached to the hospital. I think it's a big asset for many reasons. When we admit patients who needs rehabilitations or IV antibiotic therapy, they are elderly patients and they are weak patients with multiple comorbidities.
Gotcha. And lots of complexities.
Absolutely, and sometimes they need medical services that is difficult to find in another skill unit. They may decompensate, and we can, act very fast.
So when they decline, you have the ER docs and nurses that can immediately respond.
Absolutely, they can be in the ER in minutes.
Yes.
Or we can treat like blood transfusion. We can do things in the skilled unit because it's attached to the hospital.
Have a much more complex patient, medically complex patient.
Absolutely, and if we need a consultant, we can get the consultant.
So you get your specialists in. Mm-hmm. So if a patient decompensates, otherwise known as starts to go down fast, if you're in a detached skilled unit, you have to call an ambulance service to transport the patient.
Right.
And that time lag could be critical.
Absolutely.
Whereas here, they just come over from the ER. I got it. Wow, that makes a whole lot of sense. Well, thank you so much for what you do for us. Thank you for overseeing this wonderful unit that's unique. And it's a value to our community. So thank you very much for joining us today on A Cup of Joe, and I look forward to seeing you next week.